talk a few words on age and fertility, and I know a lot of you here is patients, potential patients, but also I always see you as ambassadors as well, to spread the word out there as well. My passion in fertility is general fertility, but basically it's also looking at fertility preservation, and especially in the cancer patients. So these are patients that's been diagnosed with cancer, and now suddenly they need to go through treatment that can harm their fertility potential. So knowing this as well, and this is the discussion I always have with them as well, what is your fertility potential currently, and knowingly that the life-saving treatment they're going to get is going to harm their current fertility status. So again, if we can maybe just go to the next slide. And again, I'm just going to talk about principles so just on the next slide. Saskia, is it here? Sorry, I can do it. Okay, so this is just a graph, and this is always a graph that we use to show our patients that to know that all our patients, every female is been born with a certain number of eggs, and then as she gets older, that this number starts to decrease. So the first question we always have when the patient comes and see us and say, "Doctor, but what is my fertility potential? What is my eggs looking like?" And we say, well, we can never say there's a few factors that can tell us what it most likely is. But one thing we know is age plays the biggest role in a woman's fertility potential and egg quality. And the other thing would be, and this is where it's very important as well, for a woman to realize she needs to protect her eggs, because this is the eggs, she'll have this in her lifetime, is to know that egg reserve will also play. So as your egg reserve starts to decrease, the quality also decreases with that as well. Like the genetics guys have spoken about as well, that there is some genetic background. Some females do have a genetic issue, and a very small percentage of our patients, 7%, will have a genetic problem where they might have a translocation, and that can affect their egg quality as well. But basically, it's age and it's your egg reserve. So as ambassadors, as people being here as well, to know that, and I do think this is a message that we have to carry out there as well, to tell our patients, know your own. I think everyone knows their own age, but they don't know their fertility age. And I think it is important to go to a gynecologist and make sure that you do understand where is your fertility reserve, and rather to start planning as well. So as we started to try to increase the message out there on fertility preservation, and not just in our cancer patients, now we're talking about young females that have been diagnosed with endometriosis as well, and then they would go from one surgeon to another surgeon, and obviously we know that endometriosis does affect your ovaries, and they get repeated surgeries on these ovaries. And with every surgery, the egg reserve will be damaged. So it's rather better to refer these patients to say, well, have you ever thought about maybe preserving your eggs, and preserving this at a very young age, and have some eggs available as insurance to make sure that that one day when you do want to conceive as well, that you have some eggs that we've got in storage. Another thing what we see, and I think Dr. Rodriguez is here as well, and Dr. Clark as well, in a lot of our patients, like we do see in Johannesburg as well, they are professional, so they do focus more on their careers, and they postpone their families. And by the time they get to us as well, they've met Mr. or Mrs. Right or wrong. Now they present to us and to say, well, okay, doc, I want to conceive. I'm successful in my career. Now I want to have children. Me and my husband have been trying for the last year, but things does not happen. And again, she's 38 years of age. You do your first scan, and then the next discussion would be on, okay, you're 38, we can't do much about your age, we can't turn back the clock, but your egg reserve has diminished. And then the next question starts, but okay, doctor, so what is my egg quality? And again, the two biggest predictors of egg quality is age and egg reserve. So with someone with a lower egg reserve, that can now become challenging. And when we always speak to our patients to say, well, you're 40 years of age, you have a low egg reserve, and the quickest way to advance to getting you pregnant or to accelerate your time to a pregnancy would mean to look maybe into IVF. And the question will always be, but why IVF? Why not try intrauterine inseminations? Because again, we know with IVF as well, it's all about the egg number. So when you do stimulate this patient to try and show what the egg quality is like, you want to increase the numbers of eggs that she will be giving you, and to try and find those 1 or 2 golden eggs within a group of eggs as well. The next challenge then comes in as well when you see a patient that has a low egg reserve. You do stimulate her with a high dose of gonadotropins, and she produces 4 to 6 eggs at a time. And I do think this is where the industry and this is where our fertility clinics need to come in as well, to say you cannot expect a patient to do 1 IVF cycle for the cost of just doing IVF as well. So again, there's a new terminology that we called embryo accumulation, where you would stimulate someone, fertilize the 6 eggs, see if we cannot get that golden egg or embryo, and then if you find it, great, now we can start looking at transferring that embryo. But the next thing, if you don't find it, and a patient do not have the liberty of try and save up for another year, to try and accommodate that patient to say, well, let's look at embryo accumulation. Let's stimulate you and try and reduce the cost of IVF, and try and help you to seek for your 1 golden egg that you are looking for within your lifetime. And I think these are sort of principles that we have put out there to say, how can you assist someone to get to their life's dream as well? Because we do realize the challenges. There's not much you can do about your egg reserve, your age, but we can look at assisting in financially and assisting these patients to get to their golden age or to get to their golden embryo. Again, I'm not going to say much more about the female age. We know the challenges, and you know this. If you look at always what is the biggest predictor of success for IVF, it is the egg quality. And again, the challenges regarding the egg quality, female age and reserve, again, it's to try and accommodate these patients to try and look for their golden egg. If you would then look at, again, we spoke about egg potential with IVF as well. And again, this is the biggest determinant of success. But again, just buying into the journey. And we always say to a patient, we hope the journey is short. But to buy into it as well, to say, well, we might not within the first cycle get that golden egg. Let's try and get you onto a journey of maybe 2 or 3 stimulation protocols to get to that golden egg. Next question would always be, but doctor, when should I start considering egg donor? If I repeatedly find poor quality embryos that test genetically abnormal, when should we start thinking that the treatment here that we're doing is futile? And again, that's a very difficult question, and I do think it's the emotional journey in getting there. In the older days, we always talked about free stimulation cycles, and then you make a call and say, move on to donor eggs. But I do think it's a personal decision. It's a decision that you do take with your fertility specialist to say, Doc, I'm here, I'm ready to give up, and maybe that's a time to say, well, okay, maybe before that. Again, it's not all about your own genetics, it's more about the nurturing of being a parent, to maybe then consider to move on to egg donation. Again, there's other issues as well. I'm not going to talk, and I think it's a difficult discussion just to have in a short time, is on the uterine factors as well. Let's just jump a bit to male and fertility in males as well. So again, males is different than females. Males keep continuously making sperm. Someone said the other day, with every heartbeat, there's about 1,000 sperm that's been made, but that's almost the rate there is. So the guys with a very quick heart rate, these are the fertile guys. No, that's just a joke, but again, aging in men is not that significant. We know after the age of 50, there's a higher DNA fragmentation. So then the sperm starts to look a bit, they're moving slower, the sperm count comes lower, but it's not that significant. We do know that males, and again, this is in females as well, that someone will always ask you, but doctor, how can I improve my egg quality? And again, this goes for the same of male sperm as well, is to look at your weight, to look at your lifestyle factors. Again, everything in moderation. I always say I don't want to convert you into a pastor, but at the end of the day, it's about life in moderation. So a few glasses of wine, make sure you're in shape. You'll never get into the shape that you were on the day that you got married, but just try and do your best. And again, it's all about lifestyle factors. Stress, yeah, we all got stress. We all live in Joburg. we can't go and live on an island and make babies, but these are things that's there. We do know that taking antioxidants, yes, that does remove the free radicals. But at the end of the day, if you've done what you can to improve your sperm count, that's what it is. And at the end of the day, to say, well, let's see what we have and what we can use to get to. So again, moving back to egg quality, we know that if there is deficiencies in male, in the sperm, that the younger egg, if you start looking at donor eggs, this can sometimes correct the defects that there is in donor in lower sperm counts as well. So at the end of the day, we're all in a journey. I think you're all patients and hopefully will become parents one day, but we're all ambassadors as well to share this journey with someone. Because somewhere, someone will be sitting, going through a journey, and you just want to start spreading the word and tell me what is your egg reserve. And I think these are general terms that we should start using in South Africa. What is your egg reserve, and why have you been operated for the last 3 or 4 years, and someone try and operate you pregnant? That's not going to happen. With every operation, your egg reserve gets damaged, and you should treasure that and look very careful after that as well. So I thank you for your time. I'm sorry I'm not that prepared, but yeah, I hope I got a message through. Thank you for your time. Thank you.